Good day everyone. With the current lecture we will finish the course of GIT infections lectures, and we will discuss few pathogens which are rarely present in clinical practice, but still they are important because they can cause disorders in human. First one is the representative of Enterobacteriaceae family. It is Klebsiella. Actually it is known by nosocomial infection, and it is extremely important nosocomial pathogen which is able to cause a lot of different diseases, but in the topic of current lecture we'll take a look on that bacteria as an important pathogen of enteric diseases. In current classification, the only species in Klebsiella genus is Klebsiella pneumonia, and the rest bacteria are classified as a subspecies of microorganism, and Klebsiella pneumonia subspecies pneumonia actually is the causative agent of GIT disorders. As an enterobacteria, it is gram-negative rod shape, not producing spores, facultative anaerobic, non-fastidious, and Klebsiella is present as a rod shape looking like anaerobics and non-motile microorganism. One of the most important factors, it is a huge capsule, which is the biggest in our course of microbiology. Due to that capsule, bacteria is resistant to environmental factors. It can survive in the soil, in the water, or in surrounding objects. Bacteria can multiply in room temperature, but as well as can survive in the refrigerator and can cause spoilage on food products, especially based on the milk. Naturally, Klebsiella is found in intestine of animals and human as a normal flora, and pathogenic strains, antipathogenic strains of Klebsiella can produce toxin which resembles ST toxins of E. coli. By structure and by mode of activity, they are very close. As for any other enterobacteria, Maconchi agar should be used for cultivation of Klebsiella. You see that agar itself changing color a little, and colonies will be pink, and they are much bigger than other enterobacteria due to intense production of mucus with the help of that capsule. And even in routine laboratory, it is possible to identify Klebsiella just by looking at the colony. They will be much bigger than that one, and a lot of mucoid discharge around is observed. On clearly ripe agar, it is again very easy to identify Klebsiella due to abundant production of gas, extremely huge amount, and the whole agar is pushed up on the half of the test tube. Bacteria utilizing glucose and more weak, but some lactose fermentation will be observed as well with production of acid without H2S. So as any other enteric disease, food infections and food poisoning by Klebsiella are transmitted by alimentary way. Rarely in younger kids in the first years of life, they can be transmitted by air droplets or by contact through some common toys, common hygienic stuffs. And in adults, very often it is spoiled food which is to blame. It is a meat and milk products. Initially, milk can be contaminated by human who is ill or carry the bacteria as a normal flora. Incubation period varies, depends on the age and severity of the disease. Can start in few hours after ingestion of the food product, or can last up to 6 days. Usually disease is very short in manifestation, a few days of acute nausea, vomiting, and diarrhea, which is watery by characteristics. And especially in younger kids, stool can have greenish color because of intense production of mucus, and sometimes traces of blood can appear. Diarrhea can be very frequent, and not excess in amount, but it can bother subject up to 20 times per day. Means that every hour people will feel that some discomfort and diarrhea will appear. One important pathogen, we will discuss it later during lectures about zoonotic agents. It is Bacillus, and that species Bacillus cereus, which can cause some GIT disorders. Bacteria is gram-positive bacilli. It is non-motile, have a good developed capsule, facultative anaerobic by type of respiration, and it has very unique appearance. It is huge rod with square ends, usually in short chains, and it can produce central oval spores, which is an important factor of transmission of the disease in environment. In blood agar, bacteria is beta hemolytic, and till nowadays it is one of the largest bacteria pathogenic for human described worldwide. Spores, as in any other bacteria, is very important factor of surveillance, and they are commonly found in surrounding us soil, and of course they can accidentally get into the food. For cultivation and for confirmation of bacillus, we need to use blood agar. Colonies will be surrounded by a very large zone of hemolysis. It is beta complete hemolysis, and colonies have unique appearance. They are grayish in color with granular structure and rough surface. And again, for fast identification of that bacteria, we have a rapid diagnostic tests. One shown here, it is a kit for rapid diagnosis of the pathogen in stool sample or in food products. Bacteria, again, common microbe found in soil, so usually some soil products or food products obtained from soil, vegetables, especially rice, acting as the source of infection. The most important factor of pathogenicity is enteric toxin, which is produced, and actually rapid kits for diagnosis are targeted to identify toxin itself, not even a bacteria. It is antitoxic test. We have two main types of infection caused by Bacillus cereus. One is known as emetic food poisoning. It is transmitted by fried rice and pasta when in some cultures, or when multiple people are going to some holiday. Usually it is a restaurant with the big reservoirs for food, when they stand in and they heat it for a long time period to keep it warm. And in that case, bacteria will survive in food product. It will multiply and produce toxin. That toxin will accumulate in the food, and while that food is hot, bacteria have very good condition for surveillance. And when that food is taken for by human, then usually within few hours, subject will feel nausea, vomiting, some abdominal cramps, and diarrhea will appear. Usually disease is self-limited and will disappear in the first day after infection, after poisoning, and symptoms are not really specific. Second type is diarrheal food poisoning. It lasts for longer time period, the same ways of transmission, but mainly source of infection is sausages and some meat dishes, not rice, and incubation period is longer for about a day. Diarrhea in that case is much more profuse, with more painful discomfort in abdomen with cramps, and usually vomiting is not observed in that case. So of course, by clinical manifestations, both types of infections are similar, but diarrheal food poisoning is ingestion of more amount of toxin, when not stomach, when intestine is affected more. We talked already about Staphylococcus, and we discussed pathogenic properties and cultivation of Staphylococcus. Only 3 words I will remind you. Bacteria is gram-positive spherical shape. Usually it is the normal flora of human body, and in rare cases it can produce a number of enterotoxins, which can cause food poisoning while accumulating in refrigerator, and usually again it is a food infection, food poisoning actually, when human itself is the source of infection, because microbe from skin will get into some food product due to low hygienic measures. And by release of enterotoxins, bacteria will cause self-limited mild disease with very short incubation period. Usually it starts within a few hours after ingestion of the food. And again, it manifests with nausea and vomiting, maybe diarrhea, but only watery, without any blood or mucus, without destruction of cells. Toxin have only local activity. And for all pathogens, for all 3 pathogens, we don't need, of course, some antibacterial treatment. Only fluid replacement and electrolyte replacement are required, because all diseases are self-limited and usually caused by a toxin, not by a bacteria. Even if it is microorganisms, still you need to give only proper diet and proper replacement of fluids, and our normal microflora will deal with the pathogen easily without even your invasion. Hospitalization is not required, and human-to-human transmission are not possible because actually it is again toxin which accumulates in the food. So isolation of personnel is not obligate, and only non-specific measures such as use of clean water, proper sanitations are required. Again, usually it's not even necessary because those people will not go to the doctor. They will sit home for a day or a little more. They will recover spontaneously and they will not look for medical help. But if it is some kids collective, it is a kindergarten or school, it is obligate to identify source of infection and obligate to identify the reason of the disease. Then you need to confirm disease and put precise diagnosis. We have a test which is a type of gel precipitation test. They performed on micro slides. It is agar gel with antibodies against toxin of Bacillus or Staphylococcus, and if in your sample the toxin is present, it will diffuse in the gel, and in some distance in the center of the slide it is a test sample. It will diffuse in the gel and some precipitation strip will appear in 4 to 6 hours. It's looking like white, opaque, semi-transparent stream. So it is confirmation of the diagnosis, but routinely it's not required because people will treat at home with non-specific measures. So with the current lecture we will finish topic of GIT infections. Keep safe, wash your hands, and use only good food. Thank you, bye bye.